This is Trans Radio, transmitting throughout the UK and the world. This is transradio.co.uk.
This Thursday afternoon, as promised, got a special guest just on the line with us today. So Dr Webberley, good afternoon, Dr Webberley.
Hello, hi.
Hi, thanks so much for coming online and speaking to us today. Yes, so Dr Webberley is an online service, which I've used myself. So yeah, could you let us know how you got into the gender scene, if you like?
Yeah, no problem. So I suppose as a doctor, when I was growing up as a doctor, I was training to be a GP, and I also did sexual health. That's kind of where I got my first foothold into that kind of diversity. So I've always been really excited and interested in the kind of gender, in sexual diversity, sexuality, all of those kind of things. And it wasn't until a little bit later that I realised, actually, when I moved to Wales as a GP, that I realised how kind of sparse the NHS care for transgender people was. And it was about the same time that I was developing my interest in the kind of digital medicine, because everyone does everything online. That they shop, they look up recipes, they bank, and everything's done online. But healthcare wasn't. So I kind of mixed up the two, and I thought, I'm going to put a little web page up there just to see whether there's any transgender people who need advice on how to get the best out of the NHS, or how to get this, where to get that. So I started a web page, and I literally couldn't believe how many people needed the help and advice, really. Anyone who says that, being transgender is rare as hen's teeth, they have no idea at all, and it's really opened my eyes how many people just need a bit of help and a bit of advice, really.
Oh, it's absolutely fabulous. So let's just say, somebody comes onto your web page and they're looking for your services. What's the actual procedure that they'd have to go to?
So the way that we like to do it is the website provides a portal, if you like. It's a contact form where anyone can ask any question that they like. And, that doesn't necessarily mean about healthcare. People ask us about schools. They ask us about how to get the best out of their GP. They ask us about how to get referred to the NHS gender clinics, about passport changes, about hormones, about blood tests. People ask us anything that they like. So our website is a portal for information for anybody. And all of that kind of advice is free. So Gender GP is working up to being the kind of a big resource for UK, Europe, trans people to get any advice they want.
Oh, that's absolutely fabulous.
And then basically there are some people who want to take it that bit further with the medical side of things. And so we have access to counsellors, to doctors who could prescribe hormones if that was the right thing to do, to doctors who can do passport letters. We do blood tests, medication, all of those kind of things, really.
Oh, fair. So what was the actual procedure? Somebody wants to come to you. Obviously, the waiting list with the NHS are ridiculously long, and people obviously do want to get the process rolling. So if somebody comes along to you and says, I need your help, I need to get on HRT, etc. What would the actual procedure be there?
Okay, so we've got the kind of what I call the red tape stuff, and then the medical stuff. So, we have to make sure, for example, that whoever it is that's contacting us is who they say they are, and that they consent to treatment or advice or being looked after, all those kind of things. So those are the kind of red tape things that we have to do. And then what we like to do is do a medical check. So, we'll just make sure that your medical history is okay and that there's no problems there. What illnesses have you had in the past? What medication do you take? Do you suffer with any illnesses at the moment? What's your family history like? Smoking, weight, all that kind of medical stuff, We have a lovely team of gender-specific counsellors who are there. And our view really is, it's not that everyone has to have counselling. That's not the way we work. The way we work is that our counsellors are there to help get information from people so that we can use that to best help them in their transition and work out the best plan for that individual person. So it's not about everyone having to have counselling. It's about working out the plan, having a listen to the story as your life has unfolded, and working out what kind of support needs to be put in place to help you with your transition, and to go along with the medical side. Because I think some people perhaps think maybe it's just all about the HRT, but transitioning at all, undergoing a medical transition, which is what the doctors help you with, it's a big thing. So the counsellors are there for that. So then all of that kind of gets looked at by the doctor. We do some blood tests. We like to work with your GP if possible. That's always the best way. So if your GP is happy to help, and sometimes with a little bit of information and persuasion, GPs are really happy to get on board. And then GPs can do all the blood tests that we ask them to do. They can prescribe under our supervision, all of that kind of thing. And that, some people will be familiar with that. That's what we call a shared care agreement. And then basically we look after you through your medical transition, keeping an eye on your hormone levels, keeping an eye on your medication, making sure that the changes that you're hoping for are what you're going to get from your medical transition and your HRT.
Oh, that's fabulous. Yeah, as I say, I personally have used your services and thought that they was great. I had a doctor that was very new to this kind of the field, so it was a learning curve for him. But obviously, with all the information and everything we had, it actually worked perfectly. Now, with myself, I was lucky that my doctor would do my blood tests for me, which obviously helped.
Yeah.
If somebody, if their doctor won't do the blood tests, you can obviously arrange that. Is that correct?
Yeah, and if your doctor won't, sometimes it's just because they don't know and they're scared. So what we can do is write to your doctor, we can give you information. And sometimes it's just, when you've got that bit of knowledge, GPs then are much more happy to help. Some, however, say, nah, I don't know, and I'm not doing it, and I'm not getting involved. And if that's the case, then, we have a pathology lab that we work with. So in many cases, we can send a blood kit out in the post, where you prick your finger and squeeze the little blood drops into a little tiny tube, send it back to the laboratory where they do the blood test for you. So it's like a mini blood test, but it gives the same results. And then the laboratory sends us the blood results direct. So, we always think that safety is really important. So we've got to get some blood tests done by hook or by crook. And if that's the way we have to do it, then it works really well for a lot of people.
Oh, that's brilliant. So for say that somebody's gone through the procedure and spoken to your counsellors, etc., and they want you to prescribe them HRT, what's the actual procedure about getting the medication?
Okay, so we work with a chemist called Clear Chemist, and what the doctors would do is send over a prescription to Clear Chemist, and then Clear Chemist would send you a link, which and then you would go onto their website and order the medication that's on the prescription, and then they would send it out to you in the post. And we find that by far the majority of people, it works really well. Some people prefer to have, a traditional paper prescription that they can take to their own pharmacy, and that's fine too. So, there are different ways of getting your medication, but our partner chemist is Clear Chemist, and, we've been doing this for 3 years now, and it's working really well.
Fabulous. I was just about to ask you, how long have you actually been doing this? So 2 years, was it now? Did you say?
3 years.
3 years.
I think
Okay.
I think we put our webpage up. I think in early 2015, and it's just kind of snowballed since then. Really, it's been amazing. And I have to say at this point that being welcomed into the transgender community has been, it's been a real privilege for us actually, because I know that place doesn't come easily. It's not a guaranteed place, in your hearts. And I think, that we have been accepted, and we can show that what we are trying to do is really revolutionise trans healthcare, and our premise is that we believe people. If people come to us and say, I think I might be transgender, or I need some help with being transgender, I need some help with medication, can you give me that? We don't want to put people through a massive load of hoops to prove it. We start with the premise that we believe you, and what we're there to do is support and help you in whatever way you need. And it's been a real pleasure working with the community, I have to say.
Yeah, that's fabulous. I don't think anyone would actually choose to be transgender, so they would only be coming to you for the service, if they really, really need it. What's the kind of time scale? So from somebody originally contacting you to being able to be prescribed with some form of HRT?
Yeah, I mean, it varies, but I guess if everything is very smooth and the blood tests don't cause hiccup in, because that's often something that people struggle with it, getting hold of their GP or what have you. But if everything runs really smoothly, I'm guessing about 4 to 6 weeks. If it's a very straightforward, no problems, this is a definite medical transition is the right thing to do for this person at that time, everything's in place, then it's very easy. And then for other people, we just need to take that little bit more time to make sure that everything around them, in their personal life, in their support structure, is really ready for this next big step. And maybe sometimes that takes a bit longer, So everyone is different, and we have, it sounds very cliche, but what we want to do is really provide that individual treatment path plan that's right, that we feel is right for you, and that you feel is right for you. And that's the way that we want to work.
How many people have you actually got in your team that are there working?
The team, it's growing all the time, our team. So we have 3 people who work on the admin side, and then we have a lovely team of counsellors who, they don't just work for us, they have their own, business as well, providing counselling services. So, if any of your listeners, want to get involved, we're always looking for good people to join the team, to spread the word, and to kind of, bring in the modern trans healthcare,
Right, cool. Now, obviously, there's few people that like to sort of, obviously with the internet and what have you not, there is a wide range of services. One of the questions I've been asked to ask you is, do you offer a blood test only service?
We offer an anything only service. If you just need someone to talk to, we can sort that out. If you've got absolutely everything in place in your life and you just want medication, hormone replacement therapy, and we think that's right, you could just have HRT. If you just already got your medication from we prefer people to have a nice safe source for medication, but if you've got a nice safe source for medication, you just need a couple of extra blood tests or even your first blood test, no problem at all. There is no fixed recipe to what we make people have, if you know what I mean.
So just a couple of, obviously, if you could just let everyone know how they can contact you. I do have a couple of questions that I want to ask you after, but regarding your service, if you can just clarify just again for everyone that's listening in how they can contact you and how they can use any part of your service.
Yeah, the best way is if you go to www.gendergt.co.uk, there's a contact form on there, and honestly feel free to ask anything. It doesn't mean that you suddenly have to start a transition that you'll never have a chance to get off. No problem at all. If you just want to just say hello and make contact for the future, it's not a problem. So just go on to gendergt.co.uk, fill the contact form in, and we'll get in touch. One thing I would say actually is that, with the very nature of this, I think what happens is some people contact us through the website. We answer, but it goes into their spam. And I don't know what happens. And I think those people, I feel sad because I think sometimes those people might think that we didn't answer or we didn't think that they were worth it or something like that. We answer everybody. So if you didn't get a reply, it wasn't because we didn't answer you. It was because something went wrong. And so just get back in touch again. We would never look at someone's question and go, oh, you know what, I'm not answering that. We just wouldn't.
Cool. Right. Okay. So there you go. You've got the full details, guys, of how you can contact Dr Webberley and her team. Should you want any information, just head over to our website. Yeah, a couple of other questions that we've had come through. So do you advocate the use of blockers, anti-androgens like finasteride or Decapeptyl?
Okay. So for just going back to the kind of basics, really, if you want to have medication for transitioning, so medical transition, there's 2 aspects to it. One is to switch off your natural hormone production, and the other is to give you the hormone of your gender identity, the one that you can't naturally produce on your own. So in some way, we have to switch off your natural hormone production. The best way of doing that is to use the blocker injections, because they work at a high level in the brain. They stop all the signals from the brain going down to your ovaries or testicles, whichever you have, and stop that hormone production. So they are the best. However, we need a doctor or a nurse to inject them. They're quite expensive if you have to buy them yourself. So not everyone has the luxury of being able to have the hormone blocking injections. If you don't have that luxury or can't afford it, or your GP won't help, because I have to say at this point, if your GP will help and will prescribe under our doctor's supervision, those blockers are free, because the NHS will pay for them. But if they won't, then you need some kind of way of stopping your own hormone production. And that would then fall, if we were stopping testosterone production, for example, that would be tablets such as finasteride or spironolactone or cyproterone acetate, something like that.
Fab. Right. Just a question about levels now that I've had come through, and I see that this discussed on a lot of forums, and when I chat to people that I know, we have this discussion, and it seems quite a big thing about what your levels are. So the NHS target level for estradiol is 400 to 600, which is quite low compared to other countries. So with yourself, what kind of target levels do you aim for, and what kind of target levels would you say people out there should be looking for?
It's a funny one, isn't it? Because with hormone levels, you can do a blood test one day, and it could be, say, for example, it could be 500. You could do the same blood test on the same day the next week, and it could be 700. And people are like, "Hey, why? How did I jump up so quick? Or how did I jump? How come my levels stop?" And it just seems with hormones that you don't get a real steady blood test result. So what's really important to do is to look at your blood levels alongside your transition changes. So the changes that you're expecting to happen to your body and to your mind and your psyche. If your changes are coming along beautifully and you're really happy, but your levels are only 300, then don't fix what's not broken. It's more about your changes. However, if nothing is happening at all, you've got no breast development, or you've got no facial hair development, if we're talking about masculinization, but yet your levels are 400 or 500, then we should push it up a little bit, So it's really important to take the body changes and how you feel inside alongside the number, and not just act on a number alone. We tend to use the international guidelines from the UCSF, and they kind of talk about 300 to 800. But this is not an exact science. We don't know the exact right number to work at or work to. And like I said at the beginning, that number can change from week to week, and we don't understand why. So we've got to take the whole picture into consideration. That's what's most important.
Cool. Right. Well, thank you very much. I think it's been really good talking to you today. Do hope to get you online again with us. Thank you so much for your time, for your information, and it's been really good to talk to you.
Lovely. Thank you so much for having me on.
No worries. Hope to have you on again soon. It's been really informative.
Cheers.
Okay. Thank you. Bye. Okay, guys. There you go. You know where to head over to. Should you be looking for any information, or you want to actually progress with your transition, head over to the Gender GP. As I say, I've used Dr Webberley myself and highly recommend it. So, kept me out of it until the NHS, got me sorted, if you like. So, head over to Gender GP and Dr Webberley will help you along with your transition.
Get social with us at Trans Radio UK on Twitter and Facebook. Hit music. Your radio, your station. Playing hits 24 hours a day.
This is my station.
Transradio.co.uk. This is transradio.co.uk.